to better guys. I don't want to see a guy lose his career because of the concussion. I like to see him get back healthy. He's good, and then to continue on with his career, because for most guys, this is all they have.
Yeah, I think that's a really good point that you bring up, is that we're not trying at all to advocate people shouldn't be doing what they love to do. What we're advocating for is better brain health management. We want to help those continue to do what they want to do and make sure they're healthy as possible while doing it and afterwards, because, the facts are solid. We know you can have pretty serious neurological damage post, a professional career in sports, whether it is MMA, whether it's football. I've done a lot of research in footballs, professional football players. But the point is, we want to make sure, how can we help these athletes continue to do what they love to do? This is their livelihood, as you said, and be that brain health management component. That's really what we want to focus on, and make sure that, they can get back to doing what they love to do and not have the long-term ramifications.
Okay. Yeah, and to your point and to Kyle's point, Jamie, what is out there in research is ever evolving. Like you were saying about the rest. Now they're talking about that, you want to make sure that you may have some light activity. So it may not be absolute rest anymore. Whereas where we thought that it was absolute rest, stay in a dark room, shut off all the lights, don't do anything. Now the research is changing to show that, maybe it's more of a light activity, relative rest. Remove yourself from the things that trigger you, but don't be in a dark room anymore. So, and the nice part about, what we were talking about is it's always staying on the forefront of what's presenting itself. And fortunately, in situations like ours, because we're so heavy in concussion management and now we're doing the cognitive health assessments, we're always on top of the research of it all. I can't say that for a lot of other clinics that I know. I can't say that, and it kind of makes sense though. You get wrapped up in the things that you're doing. You're not always going to necessarily follow the latest research that's out there, but we're really happy in the realm that we're in because we do get research articles sent to us every month. So we're always staying on top of what's the most current. And then we've been able to find, organizations like Vox Neuro to just amplify and make that technology so much better to help these athletes out. And I get it. I was an Olympic level springboard diver. My husband was a world fastball pitcher. We understand sport. We understand athletes. We understand the psychology of it. We understand the training of it. And we just want to be able to give back as much as we can in a different way. I may not be able to give back as a springboard diver. Springboard diving and MMA fighting could not be further apart from one another. But, to be able to help these athletes, I know what it feels to be injured. And I know that, it's really shitty. You want to be able to get out there. You want to be able to fight. And we want to be able to make sure that they do it in the safest way possible.
Yeah, and I don't want to try to jump on and ask a question, but I'm really curious of King's point of view. Like, what is done today if someone goes in to the ER or goes into a clinic today from a concussion standpoint?
Yeah, thank you. That's excellent. So I can speak to our own center here that it's very limited, and I think to delve into something you were asking, a concussion is a brain injury. And I think that's what we have to tell our athletes. When you've sustained a concussion, your brain has been injured. I don't care if your MRI is normal and your EEG is normal. You have a brain injury and we need to treat it as best we can. And what's frustrating to me as a physician who's not a concussion expert is there seems to be a lack of stuff or places to send our patients. We have a concussion clinic at the Fowler Kennedy Clinic, and I've sent athletes there, and sometimes I feel I could have done that management without having sent them there. We're not getting any sort of specialized treatment that's altering the progression of the athlete's concussion. And that's very frustrating when they have severe post-concussion syndrome and they're delving into depression, suicidal ideation. They can't leave the home anymore. Horrible nightmares. It's very, very frustrating to see that. And as you kind of mentioned, like our what we're doing changes over time. Sensory deprivation, no sensory deprivation, some activity, not too much activity. And I think you guys are on top of the research more than I am, but it's an ever evolving field. And as you mentioned, everyone's individual concussion experience is different. And so how do you alter the treatment? How do you do a randomized controlled trial in concussions when everyone presents differently and recovers differently? So there's not a lot of great evidence for how to manage concussions, I think. And what I like about what you guys are doing is at least we're starting to explore that. We're doing clinical trials where we're doing using new technologies to try and pinpoint deficits in athletes' performance and tailoring treatment to that. And I'm hoping you guys will have a database eventually that we can use to answer some of these important clinical questions, because I know you guys are saying concussion management and getting the athletes back to what they love to do. I think we need to tell people when to pull the plug too, because there's 100%. Too many times we've sent athletes back in, and I'm seeing the results of guys who fought for 30, 40 years now who are violent, who are severely depressed, and it's because we didn't pull the plug. They had one fight too many. So although I agree we want the athletes to be doing what they know they love, we need to know when to pull the plug.
I'd like to give a shout out to our newest sponsor, Solutions Today Supplemental Insurance. If you're a competitor in the cage, in the boxing ring, put your body on the line every time you compete, you can get cut, you could break a leg, a finger, who knows, put you out of work. It sucks. They'll provide you with 24/7, 365 days a year supplemental insurance covering everything from hospital stays, fractures, outpatient surgery, recovery benefits, family plans, and more. They pay out in addition to all other insurance, including WSIB, employment insurance, and your work benefits. Qualification is easy. No medical test or exam needed, no occupational restrictions, and no income verification. Head on over to solutionstoday.ca and get coverage for you and your family.